Good morning and welcome everyone to this online session on the effective use of social media in patient organizations. My name is Alfonso Aguaron. I am the project manager of Lung Cancer Europe, Luce, and I will be moderating today's webinar. Today, it is my pleasure to introduce you to our speakers, Charles Bisalion, Chief Executive Officer of Adexo International and Communication Managers of Luce, and Anne-Marie Bird, President of Lung Cancer Europe, Luce. Charles and Marie, I would really like to thank you very much for your valuable and precious time today to guide us through such an interesting topic as it is how patient organizations can make the most out social media and make an effective use of the tools that these channels provide. So before we get started, I would like to give you a brief overview on the webinar dynamics. So the session will last about an hour, and during this first part, Charles and Anne-Marie will provide a comprehensive review of today's topic, which will last around 40 to 45 minutes in total. And then in the second part, you will have the possibility to ask your questions. So to do so, you have two ways. If you would like to make your question live by using your microphone, you just have to press the raise hand icon in the panel of the application you use to join the webinar, and then I will unmute you when it is your turn. Or if you prefer, you can send your questions in writing, just typing them in the Q&A or in the chat window, and then I will pass them and read them to both Charles and Anne-Marie. So being said that, and without further ado, I wish you all a very fruitful session. And Charles, I give you the floor.
Okay, thank you, Alfonso. Hello, everybody. I'm Charles Bisaillon. I'm CEO of Adexo International. We're a digital media agency and also a video production house working mostly in healthcare, food and wine, and also in social industries. I've been collaborating for now 2 years with Luce, or a little bit more than 2 years. What is my role in Luce? Well, I study new strategies, way to get into the social media trends, to meet more people, to create more discussions, and developing content, of course, which is graphical or text or video, and managing Luce's channels. And we do a lot of stuff. We have a newsletter and all of that. Of course, I have to keep the board up to date with what's going on so they can know what's going on and adjust the strategy in time to get everything going as it should go, which is good. What we have achieved up to now in Luce, well, we can say that we're at the forefront of the lung cancer community with information that are up to date, relevant, and is a reference for lung cancer patients and people impacted by lung cancer in Europe, especially. So now I'd say around the world, because we have also followers from all around the world, a lot of countries. Since I've been here, we have doubled the number of followers and engagement that we have on social media. So Facebook, we have doubled the number of followers. Twitter, more than doubled. So we're getting out there. We're always evolving and finding new ways to get inside, because communication also evolves every day. So we have to keep up to date with that and always be up to date and right there. Okay, where are we going, Chair, at this point forward? Where should we going as Luce? As you know now, with the European EU beating cancer plan and everything, we're always taking a more central role inside Europe and at policy organizations, and a lot of it going down in Brussels. So what we do, basically, we try to create a community. We want to create one voice for Europe to be able to leverage what is our point in Brussels to make the policies, to have somebody that listen to us, because the more people we are, the more stronger we're all together. And social media, I think, can help us a lot in that, either to build a community or to communicate to that community and elsewhere. Okay, so let's start the presentation. Everybody ready? So what we'll be talking about today? Well, I'll give you some numbers about social media, just to understand where we're going and what we're talking about. Then we'll talk more about social media for patient organizations. How can social media be adapted to them, especially? Some advice and good practice. Focus on the main social platforms that we can use and that we're already using. Then how to understand the analytics data to adjust your strategy and to understand correctly if you're doing something wrong or things are going all right. Some errors to avoid, always important to know. And then we'll talk about organic organic and sponsored content. So some people maybe want to know more about that. Tags and hashtags, and of course, how to generate more engagement, which is the key to building a community. Okay, so let's start with the numbers. As we can see, there's 4.2 billion people that are active on social media today. The world population is 7.8 billion as of today, so more than half of the population is active on social media, which is a huge amount. And the thing I see on this slide that makes it wow is to see that almost all of them, 98.8%, access social media through a mobile device. So desktops slowly are fading out, and people, especially for social media, are very keen on using a mobile device. So let's say the communication should be focused mainly on them, because that's the big of the population that sees that. Okay, let's go to the next slide. The global social media users over time, you can see that it's doubled in the last 5 years, with constant decrease over the last years until last year. Of course, the trend was going down, but we can see it went back up. Could be a lot of factors. I have a couple in mind that might be the cause for this boost back up. One of them is, of course, everything that has to do with COVID and coronavirus. A lot of people are staying inside and probably gave more attention to social media than in the past because they have more time on their hands. That's one thing. The other one is TikTok. TikTok, especially last year, there was a huge increase of users because the platform just boomed, and a lot of over 35 years old I got an access and joined into this platform that was usually for kids that played around, shared stuff, but became now a really important channel. And if some of you have TikTok, you can even see that there's even a lung cancer community inside TikTok. So we'll talk about more later. Okay, and let's go to the next slide. Here you can see the world's most used social platforms. Facebook, of course, is still #1, followed by YouTube, which is very, very big as well. Then you can see there's a big list down here, but you can see WhatsApp, messengers that are not the usual kind of social platforms that we're used to. You can see Instagram is up there. Then you have a bunch of Chinese platforms that I don't personally know, but you have TikTok right there as number 7, I believe. And well, if you see right below TikTok, there's Douyin. TikTok and Douyin are the same thing. Douyin is the equivalent of TikTok in China, basically. So they're basically the same platform. If you go down, you can see all the way down there, Twitter. It's not one of the top ones, but still it's in the top list. So it's very important, and that's probably where you get the information the fastest. You get a lot of key figures that are really important on Twitter, so you get a lot of insights and very quickly in this platform. We'll talk about more platforms later, but that's a little bit of the general aspect of what's going on today. And then we have the reasons for using social media. As you can see, first is stay up to date with news and current events, which is the most important thing for social media. People want to know what's going on. They want to get information fast, and they don't want to wait until they present it on TV, and probably it won't be there anyways. So they want to know what their friends are talking about. They want to know what's going on in the world, and they go a lot on social media for that. And I think social media is becoming more and more important for that kind of stuff. And even social media as TikTok, that were not meant to be, it's becoming very important. Then of course you have a lot of other things like finding funny and entertaining content and all that stuff. If you go a little bit more down, you can see general networking with other people. This is very relevant to us. As we are a community, we want to make sure that we stay in touch, that we have discussions, that we are able to interact with each other. And all the way down, you can see promote or support charitable causes. Okay, some people do. It's not the most popular, but it's still very important to users, because causes are very dear to a lot of people who maybe had them in family or problems with health, and they feel like they need to do something. So social media is also really big for that. And this is why we need to leverage on this, because people need to read or see content that we want to promote or share. Okay, so behind everything, we are all content creators, so we are responsible to what we post online. We sometimes put our face to it, so let's do it responsibly and properly, and let's do the right thing. And especially kids today, they're all video makers. So let's act responsibly and have a positive impact on people. Okay. So what can patient organizations do to maximize impact on social media and to grow a larger community? Well, we have raising awareness, that I think is one of the main motivations for patient communities, organizations, because raising awareness is all about showing people that problems still exist, and we want to make sure that everybody knows about it, like stigma, or the fact that everybody can get cancer, not just smokers, for example. Okay, but let's go one by one. So connected communities, raising awareness is very important. Encourage patient engagement. You want to have discussions with people. You want to make sure that you're present so that they know that they can trust you on either information or support, because support to patient and caregivers is also very important. They're looking for support, and that's what we're there to give them. We want to help them to go through what they're going through. Answer common questions, because everybody has questions, especially new patients. They have many questions. They want to know what the best solution is for them. Combat misinformation, of course. And we all want to make sure that we're doing the right thing. And of course, healthcare news monitoring, because we want to know what's going on, new treatments, new trials out there, okay? So I'll give you an example here of connected community for World Cancer Day. Luce and a lot of other organizations gathered together to make a common voice to get the message out there that we are together as united. We can go somewhere. We can really get something going if we're united. And Lung Cancer Day is a good example of this, because as you can see, even Twitter joins into the cause by adding automatically a ribbon beside the hashtag. So it's not only the community, but it's also the platform itself. It's to make the voice stronger, to make it a really important message so it gets heard. So something changes, so people take that into conscious and act on it. Okay, so the World Cancer Day, we thought this year went very nicely. Like a lot of people shared the content, and I think year after year, it's getting even more important, and the message also is getting heard much more. Okay. Here, I'm giving you an example of raising awareness. We can see here that EGFR UK, one of the associations here, takes this opportunity of a good news, because this is a news that came out not too long ago on The Guardian and other newspapers, the outcome of a study that said that CT scan catches 70% of lung cancers at early stage, which is a really good news. And the EGFR Positive UK uses this news to remind us that early diagnosis is the key for all lung patient, cancer patients, sorry. I'm thinking in Italian sometimes. So taking sometimes just the opportunity to say the same message in a different way, leveraging on news to make it even stronger, to remind us that early diagnosis saves lives. And we all need to know that, because it's not everybody still. We're still a little bit down the road, but we're getting there. Encourage engagement. Another example here from GO2 Foundation. In this post, they encourage people impacted by lung cancer to share their story. Some people, they really need to talk about it. It's important for them to talk about it, and for other people, it's important to read about it. So sharing stories in this context here, of course, is one of the communication strategy that they're utilizing, not only to gain more followers. Of course, it could bring new people to like what they're doing and to follow them, but it's more to get deeper inside the community, to get their roots in there, and to also put trust into people. They're there to listen, to help them. It's we all know that for lung cancer patients, this is very important to be there, to listen to people, because a lot of them have stories to share, and I think we should listen to them sometimes. Okay. Support to patient and caregivers. Another example, Cancer Support Community. This is a page on Facebook. Basically, they're offering They're offering personalized information about biomarker testing to patients. That patients can answer just a couple of questions, and they will send personalized information directly to that person about their stages of cancer and where they're at and what's their best options. So supporting in a physical way, supporting as listening to people, but also supporting as giving tools for people to be able to also become advocates of themselves, to be able to take care of themselves as patients, people who wants to keep going and to have a voice, because we all have a voice, especially those impacted most by this incident. Personalized care is what we're aiming for in 2021. So give the tools and information to the people that need them, if you're able to support them in that, and if you're able to take that. Okay, next, you can answer common questions. So just having either, like this is an example here, just a post saying that we'll answer your questions. You have something, we have experts here that are willing to answer all your questions if they can in a timely manner to help you in your quest, because it's not easy and we know that, and we're here to help. So that could be just answering from direct messages on Facebook or Twitter directly to the person, or answering to comments in posts, also commenting on other people's posts and engaging in discussion with different groups or threads, you know, just answering questions, because a lot of people have them and we have the answers. I think we can give the right ones to the people who need it the most. Okay. Next is the example. Combat misinformation. This is an example of something that came out not too long ago. Why we know face masks don't cause lung cancer, despite what you've seen on Facebook. I don't know if some of you have seen, but some news came out recently that wearing a face mask for a long time can give you lung cancer, which has no evidence whatsoever to back this up. In fact, a lot of doctors and key figures have told us that that's not the right thing, that it's of course fake news, and that we don't fall into that. So usually fake news die after a little bit. They don't take too long to get have their mask off so we can see their face. And so fake news, let's get onto it and combat misinformation. Okay. Next, healthcare news monitoring. That's one of the main things I think a patient organization can do, is to keep informed about what's going on with new treatments, new trials, new policies. And this is, for example, one of the news that came out also recently about the new KRAS mutation inhibitor. And of course, the New York Times put like a big title to make it very attracting. Our scientists shot down cancer's dead star. Okay, it works for them, but for us, it's a very big news. It's basically the first treatment for the KRAS mutation. So even IASC, I can never say that one. Even the YASC shared this one to make it worldwide news so that people see it. A lot of people follow ASC. They're one of the references in the community, and I think it's a good thing that they shared this kind of information, because it's good news for all patients and caregivers here. Okay, so let's ask ourselves a question. Where is your audience? So what is your goal on social media as a patient organization? What is your goal? What is the message you want to give? What's the language used? Like which country you're from? What's the cultural trends that make that people use one platform or another, or language, or a way of saying? So where's your audience? Where should you speak that people will listen to? You know, of course, your channel is better than I, but in general, lung cancer communities, like the big groups, tend to stay on some main platforms where you can join and make everything there as a group with other people as a united community. So let's see, where is the lung cancer community? Where's the activity on social media here? Okay, I've listed the main ones, of course, and I put and more below because there's many more, and many more that we don't know about that are present in only one country, or they're present, I don't know, on the dark web. I'm inventing right now, I'm not sure, but there's a lot of different places around. So let's talk about the biggest ones. So Facebook, of course, still the largest, the first, the most planetary global media that there is. Many associations have Facebook page and post regularly to their audience. But Facebook, in the end, is famous for what? It's famous for dog pictures, food, selfies, all kinds of stuff that is really personal. You know, we show people what we want to show them. It's less focus on brands. It's more on like your friends. You know, it's how to keep track. That was the first Facebook. The purpose at the beginning was to keep in touch with your friends. You know, and I believe it's still pretty much like this today. Let's say that Facebook's age target is much older than a lot of other social media. So Facebook is also the place where you would get maybe more people impacted by lung cancer because of the age group, which is the highest. You know, normally I think if people of a certain age, I'm talking 80 years old, if they have social media, normally it's Facebook. Yeah, of course, maybe WhatsApp and stuff like that. But all the other new ones, it's a different story for them. Like technology is it's all new to them. Like they've seen it coming up with us. Well, me, I'm saying I'm 45 years old, so it's hard for them to be on social media, and Facebook is probably the easiest, most intuitive, and where most they know some other people. So I think it's very important to be on Facebook for that purpose, because that's where most people who are impacted are at this point. Facebook is not always easy to deal with. The algorithm it talks in its own language, and you just have to play by the rules. You can't do what you want on Facebook. You have to work around with the rules that they make. And some of the stuff is like pictures and links and stuff like that. It's always hard to deal with. It's good to understand how Facebook works and learn by trial and error how to make the best out of it. It's not always easy. Just for an example, the best picture size we say is 1,200 pixels by 630, which is like a rectangular size, like the normal size picture on Facebook. But Facebook is a little bit flexible on that. If you have bigger ones, it lets you do it. If you have long text, you can post everything. I think Facebook is pretty much flexible on stuff. Like, just have to work around and learn how the algorithm works to get a good grip on it. What about the hashtags? On Facebook, hashtags don't have such a big impact as on Twitter. You probably know that hashtags were born on Twitter, and they're really integrated into it. Facebook uses them, but it doesn't seem like it's getting the message really rooted in these hashtags, even though I use it. I mean, it's always good to put all the odds on your side. So what can I say more? The algorithm will show each new post to a number of people in your network at the beginning when you post a new post. And yeah, according to the initial evaluation of your post and the initial engagement of the first people who see it, if you get a lot of like from the first users, or then Facebook will decide to promote you in certain levels, like your first class post, your second class post, and then decide to share it to, oh, not share it, sorry, to propose it to other people in your network, or maybe even outside your network if you get a good grip. Let's say the more reach you have, the more chance you have to get engagement and to get your message across. So it's important to make quality posts, quality graphics and strong messages. So to make sure to get the initial engagement going to go further, and that your message can be heard and you can become slowly a reference in social media and have your message going across. One other things, I can tell you many things about Facebook. Here's one other thing. If you post a picture or a link, but if you have a link to YouTube, let's say, or to a blog somewhere, because you're talking about this article, you want people to go and read the article, this is one of the things that Facebook algorithm tend to classify you lower, give less importance to your post, because you're bringing traffic outside of Facebook. And Facebook doesn't want that. So, of course, it's not, your reach doesn't go to zero, of course. It still goes into your network, but not as much as if you would have, let's say, a picture of your face. Picture of your face, the algorithm recognizes it as a really high quality post because it talks about you, and these ones usually go way further. They reach a lot of more people than posts with links. You just have to learn how things are going, adapt, and get better at it. I mean, there's no really way out of it. There's a lot of sites talking about ways and tricks, and yeah, that's good stuff as well. Learn every way you can to make it better. Some other thing we can talk about Facebook. Sometimes you post a link with that's a news link, which brings the picture from the website, brings the title from the website, and makes it as if you're posting a news. And that works very good if the picture is good, because a lot of time, since the picture comes from the website, Facebook has to understand what is the picture size, what is that, and sometimes makes decisions that you don't want. Sometimes the picture is very small, sometimes the picture is cut, sometimes there's no picture at all, and you want to make the best out of your post, so you try to figure it out. Maybe you want to not use the traditional news sharing with the title, but maybe you want to make your own picture and put the link inside just to make it more visible, more professional. I mean, it's all about your profile or your page's image. So make it the best way you can. Okay. Okay, let's talk about Twitter. What I can say about Twitter is probably the most thriving lung cancer community on social media from my experience. Could be different from other associations of the other parts of the world, but I feel that Twitter has very fast information, very precise information from key figures. So many oncologists have Twitter accounts and post regularly. So people use that to get their information to keep up to date. Problems with Twitter: they have a very strict rule on picture size. So same thing, same thing as on Facebook, 1200 by 630 pixels is the best. But here on Twitter, if you go outside too much of this range, you'll just get cut pictures. So maybe you can't see the logo, you can't see the title. And sometimes it's annoying. You just have to go and remake another picture, especially for Twitter, if you want to have a good picture, because if not, it's not working. It's not working properly for you. There's also, of course, the character limit, which made Twitter famous in the beginning, which is 280 characters. You can't post more than that. So this is where hashtags also came into place, where you wanted to write something and you wanted to add hashtags, but then you can just put the hashtags in your writing to the key words that you want to hashtag and point out, right? And hashtags in Twitter can be used very efficiently, like we saw with World Cancer Day, and there's many more examples like that, where events or communities have their own and use Twitter to really generate a lot of things going from them. Some of you know all the other social media icons I've put in here. Pinterest, I don't know if anybody uses that. Pinterest, there is a large lung cancer community on there. I don't personally have an account, but I went digging into it, and Pinterest has a lot of things going on. It's mostly based on picture content, so a lot of posters about facts and information for lung cancer patients and caregivers, and really in a graphical presentation way, less text, but very visual. So impacts and big titles and stuff like that. But there's something going on. So anybody has a Pinterest account or want to open a Pinterest account, I think something is going on there, and it's maybe not as big as the other two platforms I just talked about now. So maybe there's a chance to get more notoriety, let's say, because it's still in the beginning stage, or it's less important than the other ones. Well, it's important for those who have the account and use it. So everywhere is good in a sense. So LinkedIn, most of you know what LinkedIn is. LinkedIn is mostly used for connecting at a professional level, so sharing corporate events, networking a lot for career opportunities, a lot of what's going on the association side. So members, new jobs, events, if we're going to Brussels, let's say to the European Union, that's something that we want to put on LinkedIn because it's about professional content, career content, who in what company has done what, and how can we see that this person is growing inside and getting more noticed through his professional career. So LinkedIn is a lot on the professional side, like the personal professional side. I mean, less on the corporate, even though a lot of people follow associations and company because a lot of them want to be informed when there's new jobs available, stuff like that. So, but LinkedIn can be used very intelligently also for patient organization, I think. Okay, let's go into something new. I don't know how many of you know TikTok. TikTok is brand new, I say a couple of years, video platform that just exploded on social media. All kids have it. Now many adults have it. There's dogs have it. The whole world is on TikTok. There's, I think, if I heard correctly, 2 billion accounts, maybe 1 billion active users. So TikTok has really big numbers, and a lot of people would say, well, TikTok is for kids. You see dances, people making faces, but it's all about true content. You want something fast, you want it to be real, and you want now. You want to see somebody's face. You want to see them taking how do you say, playing against themselves, and being an actor. And TikTok is very nice for a lot of people, but there's also a growing lung cancer community on TikTok. I saw oncologists that have a profile, and they do videos about awareness for kids, but not only for kids, because there's a lot of people on TikTok, and it's just a new way of communication. So every person that does awareness finds its own channel, and TikTok is also one of them. So if you like to try new stuff, I would say TikTok is really easy to use. It's very fun to use. Content is very addicting, and you can get a lot of information, like relevant information, and fast, because TikTok videos is maximum 1 minute. So if I want to say something to you about lung cancer now, I'm going to say it, but I'm going to go to the point like really fast, because I don't have time to tell you everything. So keep an eye on TikTok. I'm sure something in the future is going to go even deeper into this, and we can also think about having a channel on there one day. Who knows? Maybe do a dance, put our face. I mean, it's all about that kind of stuff. Instagram, of course, a lot of people have Instagram. A lot of you probably already have an Instagram account. It's owned by Facebook, so they're all the same family, of course. There's a lot of information on lung cancer on Instagram, mostly like Pinterest, more or less. A lot of pictures, posters, and visual kind of information and content. Instagram focus on age group is still younger than Facebook, of course, but a little bit bigger and a little bit larger than TikTok. So Instagram talks a little bit to the general public. It became a very important social network, and people keep track of what other people are doing through pictures and everything on Instagram. So if you have an Instagram account for an association, we don't. It's up to you. It's a good plan. Instagram is huge. You can get a lot of followers. You can get a lot of people reading the message and being touched by what you have to say. Instagram, I think, is a very valid option. Let's say, okay, let's talk about YouTube. YouTube is a very big platform. Like we saw, a second largest one. There's many videos about lung cancer. Many videos, information. Just to give you some statistics, there's probably 500 hours of video uploaded every minute on YouTube. So there's too much information, to tell you the truth. It's overwhelming. You can never go through everything, and usually people use YouTube. They connect on other socials, because they upload their videos to YouTube. Then they would put the link to have a really nice video streaming platform, so that all the streaming go in one place. The link is always to the same place. So YouTube is a good place to put your videos to be able to link to other places. But to talk to the community, I think is much more difficult because there's too many people, too many videos. You have to make your place, and I think you have a lot of work to do to be able to get noticed on there. Okay, last one I'm going to talk about is Quora. I want to say Quora or Quora. Quora is a question and answer platform, so people would come and ask the questions and people would answer. I see a lot of questions about lung cancer also on there. There's a lot of oncologist associations that already have answered questions, that have had discussions with people that had questions about lung cancer. So Quora is very big. There's so many how do you say, results that come up on Google when you ask a specific questions. Probably that question has already been asked on Quora, and you can find information you're looking for. So lung cancer, Quora is great. You can ask questions or answer questions or get information. Really, really important. There's more, of course. There are many other social platforms and more in development, of course, always new ones coming up. The best thing is to find out where your audience is and where you like to have a presence, and use that to get your message across. All right. Okay. Some advice and good practice. Okay. What content, you should ask yourself these 4 questions to be able to plan ahead pretty much. So what content will be the most interesting for my audience, which is the main thing. What is your message about? What do you want to inform your audience about? Then what form of content is better for them? Is your audience more willing to watch videos, or are you on Instagram so you're using pictures? So what's the format? Then what time should you schedule your post to ensure that most people see it? If you post it at night but everybody's sleeping, then maybe it's going to take time. It's going to fall into level 2, level 3, level 4 of priority of posts and reach less people because there's not engagement at the beginning. But if you would post, like, I don't know, if your network is active right after lunch, you post it right after lunch, and then you probably have the best possibility to get early engagement and get more reach with your posts. And the biggest question is probably, how often should I post content on my social media? Because what's the best frequency? It depends. How many posts do you want to post every week or every day? I mean, it depends on what your channel is. For patient organization, maybe posting every week is a little bit too less. Posting every hour maybe is a little bit too much, you know, and find the right balance. And most of all, yeah, find the right balance. Quality against quantity. You don't want to post too much. You don't want to post too less. You want to take the time to make a quality post with a good picture, with a good text, with tagging the people that matter, and having it come when you're not expecting it, because you want to surprise also your network. You don't want them to be expecting what's going to be coming next. You know, you always want to give them something that they will be surprised and willing to read because it's something that they're not expecting. So focus on quality. Don't put quantity out the door, of course, but I would say the balance goes more on quality than quantity. Okay. Some errors to avoid. Of course, working without a plan. If you don't know where you're going and you're doing everything day by day, it could be a little difficult to manage because you're always running behind. Basically, if you have a plan, let's just say you create a monthly posting plan, and you have like a calendar, and you can post your different days, the different picture. So let's say on Friday, I'm posting this picture with this text, with this hashtags, then you already know in advance that on Friday you're going to post that, and you can get approval from the team you're working with before posting, so that everybody's on the same page, you know. But you should be also flexible and change the plan when you need to. Like, I mean, if that post on Friday needs to be to slip because you need another post on that day, because let's say something came out or an event that you didn't know about, you have to show it on that day, because let's say there's the deadline or everything, slip it on the next week. It's not a problem. Be flexible. Don't be rigid on it, because it's not worth it. If you have good news that needs to be put out now, do it. I think it's the best way to go ahead. Prepare the graphical concept in advance. So make the picture, get the logos on there, make sure it's ready before the day you're going to post it, of course. Then let's say copying the same message strategy on multiple platforms is not a good idea, because every platform has its own language. You're not gonna talk on TikTok like you're talking on Facebook, because it doesn't work that way. People don't talk that way on TikTok. So the message can be the same message, of course, but you have to adapt it. Like, just for example, Twitter, you have to cut it to stay within the 280 words limit. The picture, you have to adapt it to TikTok or to Twitter, or else it's going to be cut off. So adapt the message, or even more, speak the language. Make a post for every platform the way it's meant to be on that platform. One other error you can make as well is using pictures that exceeds the platform limit. I see that often on socials. People don't use the best picture that they're supposed to be using, and that just sends the wrong message to me or to other users that are seeing this post. It doesn't look professional because it's cut, or it's not the highest quality possible. So make sure that your picture is good. Okay. Reposting the same post too many times, another error you can avoid. I see some people do that, or some associations do that sometimes. They want to make sure the message gets across, so they make it 2 or 3 or 4 or 5 times. I mean, some message needs to be put emphasis onto, but you have to limit yourself, because usually a lot of people, they see what you've posted, but they don't usually like or share, because they're informed. They don't need to support you. People they don't need to support you in your cause. They need to get informed, so they don't need to like it to get informed. So posting too many times is sometimes getting annoying. Is still the same thing again and again. Okay, so try to focus more on quality than quantity, of course. Okay, and of course, the main error is not verifying the source before reposting, and reposting a fake news. Please don't do that. Okay. Next page. Understanding the analytics data of Facebook. It's a very in-depth page. There's many tools inside this page that you can use to see how your posting is going, how your organization's page is going in general. There's a lot of specific pages on the left here. You can see, I'll go not into depth into all of them. I'll basically explain to you what we have here, so you can understand better how to go through them. Well, basically the main page we're viewing here is the overview, which gives you everything and nothing at once. So basically you want to go into in depth. If you go into the followers page, you get the graphical, the curve of the followers in time. So every day, if you get new followers, you see how this can be growing or going down in time. And this is probably very important, since we always want to grow our network more, right? If you go down the likes, probably the same thing. How many likes per day? And there's also by time of the day, so which hours and stuff like that. So followers, like you can get a lot of information. What I like to see here is probably the posts. This is one of the tools I use a lot, the posts. It gives you a list of all the posts in chronological order, so as you post them basically. And you can see how many people have seen it, what's the reach rate, and how many people have engaged, how many likes. So you can, this is probably the best place to see how you're going, like what's your posting going like. What's the post that have like the best, the most reach, let's say, okay? I'm a little bit over time here. Oh my God, this is too much. Alfonso, you still there?
Yeah, I'm here. Yeah, it seems
I'm going over time. I'm sorry about that.
No
I just
problem.
realized.
No problem.
Okay, I'm gonna go. Yeah. I'm gonna finish it fast, okay? Because we're almost.
No problem. No problem.
Analytics data on Twitter. I'm gonna go very fast. Twitter is probably is more different than Facebook. You can see more or less the same thing here, how many new followers and everything, but mostly focus on the top tweet, top mention to see which posts have more reach in your plan. Okay. Organic versus sponsored content. This is what I was talking about before. The organic curve you see here basically is the one below. This is the post that we have not sponsored, and the paid, of course, is the one we have sponsored. So we can see that the post we did on February 5th already had more than 2,000 people seen it, which is very, very good. But we decided to post it even more, to boost it even more, and we were reaching a lot of people on there. And the main thing about paid posts is that you can reach people outside your network. Not only your followers or your the friends of your followers, but also people that don't have anything to do with you. They've never heard of you. So this is probably a good way to get new followers, a way to make a budget for paid advertising. Tags and hashtags. I won't be going too much into this. No punctuation, no space. And you should use hashtags that are good in your industry and your organization, okay? Avoid using too many. And if you're talking about somebody or sharing some of this stuff, maybe you want to tag them to make sure everything's going so that they can see it and interact more with it, okay? Generating more engagement, go very fast, post high quality content, of course, post at the right time. So you can learn more about that if you go in depth into analytics data. Adapt the content language to the social platform to get more engagement. People's and videos uploaded directly will reach more people than links that brings outside users the platform. Interact with your followers and reply to comments. Of course, if you want to prepare a budget for sponsoring some of your posts, and optimize your social media profile. I will say that as a big important thing, your social media profile is your image, so make it look good. All right. And this is because we should use technology to generate a positive social impact on as many people as possible. And we want to build a very strong and bigger community. All right. Thank you. I went over time. I'm sorry about that, everybody.
No problem, no problem, Charles. It was being very interesting, so I didn't want to interrupt you. Probably, I know, Anne-Marie, you will need to leave shortly, but I'm going to pass you the floor as you may want to add something to what Charles presented. So I give you the floor. Yeah, that's it.
Thanks so much, Charles. That was a really great presentation. Unfortunately, I am booked now for another meeting, so I won't be able to give my section of the presentation. But what we'll do is, mine is very short anyway, really. So Alfonso's going to record that with me separately. It's only going to be probably about 15 minutes or so, and we'll also post that as well. So then you'll have both of them, if that's okay with everyone else. So unfortunately, I'm not able to stay for Q&A either. So I have to go, and that's an alarm, if you can hear it, going off in my building as well. So it's a great Friday. Okay, it's a fire alarm, so I'm going to have to go. Alrighty, thanks a million, and thank you so much again, Charles.
Thank you.
Bye, everybody.
Thank you so much, Marit. And as you said, we will definitely record this clip separately for you. So we're going then. Thank you so much, Marit. Bye-bye. So we're going to go through the Q&A part now, because we have received some questions in writing regarding your presentation, Charles. So I'm going to read them. I just want to remind all our attendees that if you want to make some questions, you can also do it by raising your hand if you prefer to do them live. So the first question is that's quite an interesting one. It's, do you think COVID-19 has changed the way people has used social media channels as face-to-face interactions has been so restricted over the world?
I think, yeah, and I can say that even the slides about the social media numbers speak for themselves. There is a large increase in social media users since the beginning of the COVID. A lot of them gathered their information from social because they couldn't meet people everywhere. And I think COVID, it's sad to say, but it was a good thing for social media platforms. Yeah.
Okay, thanks a lot for your response. You presented some new channels, Charles, but here there's a question from one of the person who has attended the webinar saying we are used to see a lot of patient groups using mainly Facebook and maybe Twitter and LinkedIn. So when you think about lung cancer, which other new channels you think is worth using? I know you have presented some others like Instagram, TikTok, and so on. But what would you say if you have to choose one more or two more? Which one be your choice?
If I have to choose one more than Facebook and Twitter, I would choose Instagram, just because Instagram is very, very big and there's so much people on there. But I would focus more on what is the platform that people in your network are using, because country by country this would change, and language by language it would be different. So even though there's not big communities on all platform, this could also be an opportunity to build one, because you're at the forefront of building it. So you can be also becoming a figure on that platform if you start yourself, you know. I think I'm not sure how many other platforms is there for the large community as on Twitter, of course, because Twitter, you have all the oncologists and everybody's sharing all this information very fast. I would say that the other platforms is mostly on information side, as informing about facts and for maybe new patients and people who are new to lung cancer, to bringing them to find information that they need. To get the new information for us, association, and for oncologists, I think nothing beats Twitter, of course.
Okay. Yeah, that's a good answer. So the next question, we have a couple of them left. It's, in my organization, we are all volunteers, so we can't spend many hours posting on social media. So what do you think we would need to prioritize given our limited amount of time that we can invest in communication, and taking also into account that we are not communication experts? So it's like, I think this is very common in many organizations, that there is not a person with a communication background, and the amount of time that they can provide is limited. So from your experience, what would you suggest, or what would be the priorities?
Okay, I would say always focus on having good graphical impact. So nice pictures is very important. But if somebody doesn't have the time or the technical aspect to make everything nice in a timely manner, I would personally say to extend the time between posts. So instead of posting every day, maybe post 2 times a week. It's better to take the time to make a good post than to want to keep up and to make a lot of posts that maybe less people would see. So take time to build quality more than to try to manage. It's better to be less present, but with quality content. This is my opinion.
Yeah, I think you stated that well in that balance slide. Sometimes quality is better than, And last question we have in here from our audience says, what is your opinion? You have mentioned that very briefly on paid posts or promoted posts to get attention from a certain audience.
Sorry, I didn't understand what you
said. What is your opinion on paid posts? So paying, like having a promotion like on Facebook, a Facebook ad or something like that to get attention from a certain audience. Would you recommend that? In which cases you think it's worth, or whether it's better to go for organic content?
Well, organic content is by default. So you're doing it, even though you're doing paid, you're always doing organic anyways. Paid is just to boost some places in your organic world, let's say. I don't know how important it is for patient organization to boost posts, because boosting posts is mostly if you want to make a profit out of it, you want to make an advertising so that more people buy your product. For patient association, you want to make your message be more out there for the people, more people to hear it. And the profit to be made is not maybe what we're thinking of, like as in a product. So for patient association, it's not necessarily essential to make a sponsored post. But as Luce and for sure a lot of the other associations do it to have a bigger web presence, because you can go outside your circle. When you pay for advertising, you can select the age group that you want to show this to, the interest that the people have, so that the post will be shown to them. So you can go outside your circle, and I think this is very important to grow, basically. So paying for patient organization to grow, I would say most of it for that, or to get your message across more.
Okay, thank you so much, Charles. And it seems that that was our last question. We have run out of time, and but before closing, not a problem at all, Charles, and also Marie, who had to leave. I would like to thank you both for such a comprehensive and outstanding presentation. I think it's been very detailed one, and I think it's going to help our audience and those who see the recording to really know more about how they can use or make effective use of all the social media tools and tips to gain attention, and at the end of the day to really support and help and reach patients in the countries, in the regions, and so on. So also, I would also like to thank our audience for attending this webinar. And I would like to remind you that the full content of this session has been recorded and will be soon uploaded by Charles to our YouTube channel. And you will receive an email as soon as it is available, so you can watch it as many times as you wish. And I also take the chance to encourage you to follow up our activities in our website, which is www.luncancereurope.eu, and of course to follow us in our social media channels, mainly Facebook, Twitter, and now LinkedIn, that we have become active recently. So you can follow us on these social media channels. So with that being said, I really wish you all a very fruitful day, and I really look forward to meeting you all shortly in our upcoming webinar. So thank you so much. Thank you so much again, Charles, and I wish you all a great weekend.
Thanks a lot.
Bye-bye.
Okay. Bye-bye.